So we ordinarily start these programs at 4:01, but we're expecting a big group today. And just if you'll bear with me for another few seconds, I just want to let as many people as possible join before we start. Just another few seconds and we'll begin. Okay, let's get underway. My name is Jerry Rosberg. For those of you who've been with us on one or more prior sessions, you recognize all the panelists that we've got here today. For those of you who are new, that we have the three leaders of the Columbia COVID response effort: Donna Lynn from the Medical Center, who is the University COVID Director; Wafa El Sadr, who is the University Professor and head of the Public Health working group that's been so important to every aspect of our response to the pandemic, and Melanie Burnitz, who is the Senior Vice President and head of Columbia Health, who's been very, very heavily involved, especially in student facing issues. In the last few sessions, we've had a format that we've used that includes a quiz. No quiz today. We're going to proceed a little bit differently. And although you're all used to this being the Donna, Wafa, Melanie show, I'm actually the one who's starting today. I want to talk a little bit about the mandate, not so much as a public health matter. I know you've got a lot of questions about medical and public health issues, and those, of course, need to be answered by our real experts, Donna and Wafa and Melanie. But I wanted to say a word about the policy of the mandate, how we got to this point, how this is likely to work in practice. So let's go ahead to the next slide. So there's a reference here first to our announcement from last Friday, May the 14th, that the mandate is going to apply to all employees, faculty, researchers, and staff. We had previously announced, all the way back on April the 19th, a mandate for students. And we've had several webinars between the student announcement and today in which we got the question, what are you doing about a mandate for faculty, researchers, and staff? And our response was that there were very intense discussions, much analysis underway on what to do about employees. The considerations were different and a little bit harder with respect to employees, and we took our time in the hope of getting this right. I think if you were listening closely in prior sessions, you probably could detect that the direction in which this was going was pro mandate for all, and that is indeed where we wound up, as announced just last Friday. Next slide. Yeah. So this slide, it talks about the goal. And it's an important slide in understanding the context in which we're doing this. If you were here 2 weeks ago and were paying close attention, you'll see that I used this same slide to talk about the return to campus. And it's not a coincidence. It's not just me trying to get multiple value out of a single slide. The point is that this goal of normal university life in September, it's what's driving everything that we're doing. It's driving our policy on return to campus, but it's also driving this mandate. And I just, in particular, wanted to call your attention to the language from Ira and Donna from last April the 26th, that we're work in anticipation of a full schedule of in-person academic instruction inside our classrooms with faculty, students, and the great majority of our staff back on campus. That's where we're trying to get. That's why we have the mandate. Next slide. So this is a slide that articulates the rationale. There's nothing here that I think will come as a great surprise to you. This is all about health, but you need to look at the first bullet because it talks about the health of Columbia affiliates and the broader university and surrounding community. This isn't just about us and what does it take to keep us safe. We live in a very dense city. We have a responsibility to our community. We're bringing a lot of people back, and we need to do that in a way that will keep everyone safe. The last bullet on this slide talks about the 300, and I think it's even bigger than that now, the number of universities and colleges that have mandated vaccination for students. And a third of them, I think the most recent number that I saw was 120, also have an employee mandate. So we are by no means alone on this. Next slide. So this is a slightly complicated slide, but let me just take a minute and go through it because it makes a couple of points that are important in understanding why we're doing what we're doing. The first bullet refers to an announcement from the CDC last week that I expect many of you heard that said fully vaccinated people don't need to wear masks, don't even need to wear them indoors except in limited circumstances. So, the key point here about that CDC announcement is that it didn't say anything about what an employer like us, what a university is supposed to do when we have fully vaccinated people and people who are not fully vaccinated, and we have no easy way of telling the difference between them. We cannot responsibly say, don't worry about distancing, don't worry about masks when we have this mixed population. And this wasn't just our view. If you look at the second bullet, the New York State Department of Health and the governor very, very quickly adopted the CDC guidance. But as you'll see in that second bullet, what they said was in indoor settings where the vaccination status of individuals is unknown, you should keep wearing masks. And as the last two bullets say, and I know you're going to hear more about this from our public health experts, we are continuing to have a mask requirement, distancing requirements indoors. It's changing outdoors. And again, you'll get more detail about that from my colleagues. But we need to maintain these rules, and we need to do it in large part because we do not have a fully vaccinated population. The point, the essence of the mandate is to get us to a fully vaccinated population so that life can get back to normal. Okay, next slide. So this is about process. And this isn't going, unfortunately, to answer all the questions you're likely to have. I know you'll have more, but a lot of this is very much in the work in progress category. So, where do you submit evidence of vaccination? We're going to have all that laid out for you by Friday of next week. That's the 28th. And at that point, we anticipate that the window will open to submit your evidence of vaccination. What we anticipate at this point is that what we will be asking you to submit is an image of your CDC vaccination record card. If you were vaccinated overseas and you don't have a CDC vaccination card, then you would take a picture of the comparable card that you got in the country where you were vaccinated. You will also have to make an attestation about vaccination. Our view at the moment is that the New York State Excelsior app, as valuable as it is not going to do the trick, that we are going to need you to submit something that shows that you were vaccinated and the date and the vaccination that you received, the particular vaccine. So on when, our assumption is that when we unveil the plan for submitting this information, we will immediately begin accepting uploads. So that starts on May the 28th. The next bullet is an extremely important one. It goes to the question of by what date must you get this done? So all of our thinking is about preparation for the fall, but it's going to take significant amount of time for us to review these submissions, to deal with requests for exemptions. And as a result of that, you should expect that you will have to submit evidence of vaccination by August the 2nd, which is the first Monday in August. So if you're asking what is the effective date of this requirement, for all practical purposes, it's really going to be August the 2nd for most current employees, because that's the date by which they will be expected to submit. The last bullet on this page says it doesn't need to be one of the US approved vaccines as long as it is approved in an emergency use authorization or other basis by either the FDA or the World Health Organization. Next slide. Okay, there will be exemptions. There are the two traditional grounds for them, and those are the two that will apply here: medical and religious. We have a lot of experience with these grounds for exemption in connection with the student vaccination mandate, which we've had for years. This is not new. We do know how to deal with this. There will be forms for you to use if you think you are eligible for an exemption. And again, that information will be available by May the 28th. Can we go to the next slide? Okay, so if you're sitting there saying, wait a minute, I haven't been vaccinated, what am I supposed to do here? The first and most immediate thing you should do is get vaccinated. Don't wait for August the 2nd. What we're going to want on August the 2nd is evidence that you are fully vaccinated, which means in the case of a two-dose vaccine that you've had both doses and the 2 weeks have gone by. So there really isn't a minute to lose. And there are vaccines available now. This is not like the beginning where people were standing on their heads trying to get in and get vaccinated. There are doses available now, and you need to get them. You shouldn't delay, not just because of the mandate, but because the sooner you're vaccinated, the safer you and those around you are going to be. Next slide. Um, Preventative measures, this is the question of masking and distancing and the rest. And I'm just going to leave that to Wafa and Melanie and Donna. I know they'll talk about that in the Q&A that's to come. Next slide. Um, this is a picture of the website where we have FAQs on vaccination. And there's the whole URL spelled out there. If you don't write that down or don't grab a screenshot of this, just go to the main COVID-19 Columbia.edu page and you can navigate to this in one click. At the top of that page, you'll see the red message that says vaccination mandate. Click on that and it will take you to the FAQs. The FAQs have a lot of information about what to expect, and they're going to be updated on a regular basis. You should bookmark it, please, and keep going back and checking because that's where you'll find more information as it becomes available. And I believe there's just one more slide. Can we go to that? Yeah. So this is not about the mandate. This is just a quick refresh for those of you who are working remotely. What I'm about to say here in these five numbered points isn't new. It's what we said 2 weeks ago. It remains the policy. But our sense is that there really is some misunderstanding on this point. So, with apologies to those of you who've heard this and have got this, let me just try one more time. Number one, the return date is determined by the school or the department. There is not a single university wide date to return. No big bang on date X, September 1 or some other date, everybody comes back. It's dependent on your school or department to do the planning and let you know. Number two is that the return is going to be phased even by the school or department. So even within a school or department, there is not likely to be a big bang in which everybody comes back. People will come back spaced in an effort to make this as stress free as we possibly can. Third, everybody will get 21 days of notice prior to the return. Four, you should know that the return is already underway. There does seem to be this misconception. I hear this often. So you're telling me I really don't need to do anything until September 1, right? Not right. The fact is that most schools are gradually bringing people back with notice on a phased approach to try to reintroduce them to campus, those who have been away, to reduce their anxiety about return and get them ready to go. Number five is a complicated sentence, but let me just go through this because this is important information. This goes to the question of what if I just want to work remotely? Can I do that? What does that even mean? So the first point here in this point five is that it's the school or department that decides on the basis of a functional analysis where work should be performed. Schools and departments will conclude that some work should continue to be performed remotely. That may be applicable to you or it may not. That's for you and your school to work out. But the key point here is that even where remote work is deemed appropriate, the likelihood is, the very strong likelihood that remote will mean hybrid. It will mean 2 or 3 days a week in the office and a couple of days working remotely. And that while this is underway in this hybrid remote, that you should be within commuting distance of the university. So people have said, well, like, I'm not within commuting distance. I'm in Oregon. Can I stay here? And the answer to that question is that a few of our employees may be able to stay in a place like Oregon that far away. We always had some people who were doing that. but that is definitely not the norm. The expectation, absent unusual circumstances, the expectation is that even those who are working remotely will be spending a significant amount of time each week in their office, on campus, in their work location, and will be within commuting distance. Okay, so that's it for working remotely. Let me now turn it back over to Donna to do what she always does so expertly, to manage the Q&A. Donna, I'm not sure the plan is today with respect to the Q&A box.
Right.
If you would start by letting everybody know what to.
Absolutely. Well, first of all, welcome everybody. Great turnout. And there are questions. Many of you have been on before and know, but if you haven't, there is a Q&A box at the bottom of your screen. You can put questions into it. We are typing as people are speaking, so I think we've already knocked off about 20 or plus questions. But I'm also going to try to group some of them so that as we turn to Melanie and to Wafa, we also get to many of your questions. So, and I'm going to start just with two clarifications on sort of the implementation side, and then turn to Melanie to talk about COVID testing, because there are a lot of questions still about, are we going to have to continue to take the gateway tests and all the other tests that we take, as well as medical exemptions. But two things I want to clarify. The mandate goes into effect, although in some cases, if schools begin before September 1st, it will go into effect before that to coincide with the beginning of a term. I use the example at the medical center. Our schools don't start for the most part. I think one does in September. The rest of them start during the summer. So you'll see variations like that. But for the majority of people, September 1 is the day that the mandate goes into effect. There was confusion about August 2nd. August 2nd is the day whereby you have to submit the information or you have to file for an exemption. What that means is if you're submitting the information and we want you to be fully vaccinated, you need to be fully vaccinated by mid-July. Okay, and we have lots of information both on our COVID-19 website and that we'll provide today that will help you understand where you can get vaccinated at Lerner, on Morningside, and there's several other Columbia locations. That's number one. The mechanics of how you will get that information to us, and we're predominantly talking to faculty and staff now, is that as you know, last year you had a Reopen CU app for those people who are accessing the campus. If you don't, and if you haven't, you simply go into the App Store. You can download Reopen CU, both on your Android as well as your iPhone. That provides you with what's called a daily attestation of your symptoms, of other conditions that you might have, and you check that on a daily basis. It also will have an upload option to scan in, take a picture of your CDC card, which is what you get if you get the vaccine in the United States, to attest to the fact that you got the vaccine and to upload that information. It also will allow you to file the exemption. And as Jerry said, we will have that available on your app on May 28th. So you can start uploading the information as soon as you like. You don't have to wait until August 2nd to do that. So that's the mechanics. I'm going to turn to Melanie, because as I said, there are a number of questions, and just for her to give a high level, what will September look like in terms of testing? We've gotten a number of requests from people who haven't been on campus for 14 months, who want to bring their own COVID test from their own local testing site, and to also talk about the medical and religious exemption for the vaccine itself. So those three key topics.
Sure. Thanks, Donna, and good afternoon, everyone. Thanks for all the excellent questions that are coming in. So regarding testing, this is continually evolving, and those of you who've been on campus since last year know that the testing program, which we rolled out last June, has gone through multiple different iterations since then. It's a very responsive program, really responsive to not only what we're seeing on campus, but what we're seeing in the surrounding communities. So it's a pretty flexible program, and one where right now I don't think it would be fair to say exactly how it's going to look in September, because there are a lot of things that are going to change between now and September. So what I will share right now is where we are right now and what we anticipate for the summer. So we still have the 2 large-scale testing sites, the one at Lerner Hall on the Morningside campus and the other in the Black Building at the CUIMC campus, as well as some other sites at Lamont, Carytown, and West 51st Street. The current requirement is anyone who hasn't been on campus throughout this calendar year does have a red pass based on not meeting the testing requirements. So it does mean right now anyone returning to campus during the summer is required to get their initial gateway test with us at one of those sites prior to that red pass going away on their app. We do maintain that it has to be a test at one of our testing sites for consistency purposes. So that is the way to get rid of that red pass on your first return to campus. Regarding the fall, again, we will provide information in terms of what the parameters are around gateway testing nearer the time. The second piece on that is what's happening with ongoing surveillance testing. And right now, so certainly for the near future, we are still sampling our population on campus on a weekly basis so that we can get a true picture of what is happening on campus and evaluate the safety of our campuses. The numbers are really low. You should go to the COVID-19 dashboard. We update that every week and see our testing numbers, but it is critical that we do that random sample every week of our entire population who's accessing campus, and that includes folks who have been vaccinated as well as those who may be partially vaccinated or not yet vaccinated, so we get that picture. So we are still including vaccinated individuals in our random sample at this time. As I mentioned, we are working with the public health experts, the infectious disease, epidemiology, and modeling experts to define how the testing program will change for the fall, and I anticipate we'll be able to update you in June around that. So Donna, did I get everything around testing that we wanted to mention?
You did.
Great. So the next piece was medical and religious exemptions, right?
Yes.
Yes. So being in the student health world, we've had a lot of experience around vaccination requirements and medical and religious exemptions. All students coming for post-secondary education have a vaccination requirement. So we have it in place on the student side, a very good process around reviewing medical and religious exemptions. And we've been sharing that more broadly so that we'll have a process in place for evaluation of medical and religious exemptions as it relates to the COVID-19 vaccine. On the medical side, I think it's really important to understand that this vaccine is not the same as every other vaccine. So even if you had a medical exemption to one vaccine, that may not be true for the COVID-19 vaccine, and vice versa. You may have never had a medical exemption for a vaccine in the past, and you may have for the COVID-19 vaccine. So if you believe that you have a medical contraindication, a reason why you shouldn't medically receive the COVID-19 vaccine, there's going to be a couple of things to do. The first will be to consult with your healthcare provider and have that conversation to see if this is a medical reason not to receive the vaccine. And if it is, you'll be provided with a way to submit the documentation through the process that Donna has described to the university in order to receive a medical exemption. Similarly, for religious exemptions, if you have a religious belief that precludes receipt of the vaccination, we'll be sharing with you the process to apply for a religious exemption. For those who receive medical and religious exemptions, you'll then be provided guidance in terms of what does that mean around the public health precautions you need to take when back on campus, as well as if there are differential testing requirements for those exemptions. So stay tuned, because that process will be available to you in the next couple of weeks.
Great. Thank you, Melanie. I'm going to turn to Wafa to talk more about the vaccines themselves. We have a number of questions, particularly about boosters that are showing up in the Q&A box. But we also want to share with you, obviously, hopefully there's great familiarity with the 3 vaccines that are currently under EUA, under the FDA, the Food and Drug Administration, and but also the World Health Organization, because we have both faculty, staff, and students coming in from international locations. And we have a number of concerns about, allergic reactions to the vaccine and what we know from a science point of view. And it also flows into the medical exemption question. So I'm going to turn it to Wafa. We'll continue to answer your questions in the box. And obviously, we'll do some live once we hear from Wafa.
Great, thank you very much, Donna. Let me first remind everyone that we're fortunate in the US to have 3 vaccines that have received the Food and Drug Administration EUA, which is emergency use authorization. And those are the Moderna vaccine, the Pfizer-BioNTech vaccine, and also the Johnson & Johnson Janssen vaccine. So these 3 vaccines are available now, and all of them have received this EUA for use. There are, for the J&J Janssen vaccine, we are required, and we do, when people receive that vaccine, to provide them with information regarding a potential for a rare side effect that has been reported with that vaccine. It's been reported about 7 individuals per million vaccinations. It's a rare event, has been noted mainly to occur in younger women, less than 50 years of age. And we do inform people who receive the vaccine of this potential rare side effect. The other is that WHO also has its own mechanism for providing emergency authorization as well. And they have given such authorization to 2 vaccines, in addition to the ones that I just mentioned, but to the AstraZeneca vaccine, as well as also more recently, about 2 weeks ago, to Sinopharm vaccine, a vaccine made in China. So from the Columbia perspective, receipt of any of these 5 vaccines thus far will be considered to actually fulfill the vaccination requirement. Obviously, 2 doses when 2 doses are required, and 1 dose when 1 dose is required, as is the case with Johnson & Johnson vaccine. Keep an eye on the website. WHO website is updated on a regular basis to see if there are other vaccines. They actually tell you when the discussions will be, which vaccines are under discussion, under review, and also give an estimate when they will determine whether, when to expect essentially a decision to be made about whether it's authorized or not. So that's the status of these vaccines. We also know that Pfizer as well has submitted a full package to the FDA to get full approval for the vaccine, for its vaccine. And we anticipate that the other companies, again, will, over time, be submitting their full packages for full approval as well. And as you know, the main difference between the EUA and the full approval is that for the full approval, it requires about a 6-month follow-up from last vaccination, and already with the Pfizer, 6 months have already accumulated, and that's why they're able to submit the data now to the FDA. Now, in terms of boosters, and many of you asked the question about boosters, and we don't know yet whether we will need to receive a booster. That's still unclear. Certainly, the pharmaceutical companies are already prepared. Several of them have manufactured new formulations of the vaccine, but we don't know as of yet whether these will be needed or not. We do have very encouraging data of durability of at least the measures of antibodies, protective antibodies in the bloodstream, and even some clinical evidence of the durability of protection with the vaccine. So I think thus far the news is good, but there may be the need for booster vaccinations if, for example, somebody resides in a country where the circulating variants are not the vaccine they've received is not protective against that variant. So stay tuned regarding the booster issue. And lastly, regarding allergic reactions, the concern is about what we call anaphylaxis, which is a severe allergic reaction that usually happens within half an hour after a medication or a vaccine. These are rare events again, and they tend to happen, like I said, within 30 minutes of receipt, here in this context of receipt of vaccine dose. There is a contraindication to getting vaccinated with any of these vaccines if the person has prior evidence of a severe reaction to one of the ingredients in the vaccine itself. So I think that's why we encourage people who have had such reactions in the past to check and see if the ingredients in the vaccine that they're supposed to get is there an ingredient in the vaccine that they already had an allergic reaction to. Then clearly they would get they should avoid getting that vaccine and maybe get another vaccine that is not that doesn't have that ingredient. Keep in mind that people who've had allergic reactions in the past, they can receive the vaccines so long as it's not an allergy to one of the ingredients in the vaccines. And what we recommend is that they receive the vaccination in a clinical setting and they're observed for a minimum of half an hour after they receive the dose of the vaccination. I'll stop here, Donna, and tackle other questions.
Yes, one question that relates to what we talked about, which is the emergency use authorization, is is the vaccine really safe? Should we be? And there actually was a quote put in one of the questions from somebody from the CDC regarding the EAU. The quote is, oops, sorry about this. The FDA says that people should have the option to accept or refuse administration of the product.
Yeah, I think it's. I think that's the. You have to weigh the benefits versus the risks of the vaccine, and of course, the risks of the disease you're trying to prevent. I mean, that's always in the equation. And by looking at these vaccines and the potential benefits of these vaccines and their safety profile, I think are all really reassuring, particularly when you take into account that how COVID-19 can be unpredictable, can cause very severe illness, if not deaths, unfortunately. And also, even in people who've had mild COVID-19, we're now learning that even in such individuals who had very mild illness, that they can have these debilitating symptoms that can last for months thereafter. So there certainly is a motivation to try as much as possible to protect oneself from getting COVID-19, whether it's a mild disease or severe disease. And that's the compelling reason, and that's why these vaccines are authorized for emergency use, because we are facing a severe emergency with COVID-19 now.
Great, thank you. We have a question that I'll tackle. We've had some long discussions today about the Excelsior app, which is the New York State app that allows, when you've gotten your vaccine in any location in New York State, to have an actual QR code that you can use to get admitted to a number of locations. And the question is, why aren't we using that? And there are a number of reasons. First of all, if you have the Excelsior app, you know that it actually expires 6 months after you have had the vaccine. So for some people, their pass is about to expire. The second is, we want you to attest, and we're hoping everybody is honest in whether it's their Excelsior app picture or it's the actual CDC code, but we have seen some evidence of fraudulent documentation around that. And then the third issue is, well, the majority of, we don't think the majority of people have the Excelsior app, and certainly many of our affiliates have gotten the vaccine outside of New York State. So for us, the easiest way was to develop a way for you to take a picture of your card. It's very easy to actually attest that you did get the vaccine that you're showing us documentation for. Sherry, I'll switch from vaccines a little bit to provide you a question that has appeared in many places in the chat box, and maybe I'll give you two parts. One is this mandate applicable for union employees? And then a second question is, what are the consequences if someone just doesn't want to get the vaccine?
So to start with the union question, yes, this is applicable to all employees. We have already initiated conversations with the union leadership of our various unions, because we want very much to do this in a collaborative spirit with them. And I'm very hopeful that those conversations will be useful and effective in facilitating the vaccination of all of our union member employees. But there is no carve out for union member employees. It's everybody who's subject to this. On the second point, and I've seen so many questions already in the Q&A, so I know this is a huge concern. What if I just don't want to get the vaccine and I refuse to do it? What happens to me? Will I be fired? Well, the first thing I want to say is that there are also questions in the chat from people saying, wait a minute, are you telling me that some people might be exempt and they're going to be sitting next to me and they're not vaccinated? Like, this is not an easy problem to solve here. We've got great concerns on both sides. People who are, for whatever reason, hesitant to get the vaccine, and people who are very fearful to be back in our workplace unless they are confident that everybody has been vaccinated. And it's trying to navigate through that difficult terrain that we came up with this rule. So, will you be terminated? I don't want to say yes to that. We're not looking to fire anybody here. This isn't about firing people. This is about making a rule intended to keep our campus safe. If you don't want the vaccine, the thing to do, if you think you could be eligible for an exemption, to apply for one. If you apply for one and are turned down, or if you don't even bother to apply for it and just refuse to be vaccinated, that's going to be an HR problem for us. And like every other HR problem, it's going to have to be addressed on an individual basis. That we're going to work with employees. Our goal, as I say, is not to fire anybody. Our goal is to make our campus safe. So I'm sorry if that's not as crisp an answer as you might like to that, but that's just the truth when you're dealing with HR problems, that they're case by case problems, and we need to look at them one at a time.
Thanks, Jerry. One other question to toss your way is about visitors. We're getting a lot of questions about visiting scholars, visiting people who want to use the library, contractors. Will we require those individuals to be vaccinated as well?
So I think there's more work to be done to develop the policy on visitors, but this much I think it's clear. It's not one rule for visitors of all kinds. I think it's really going to depend on what kind of visitor are we talking about. An academic visitor who is here for a month or the whole term will, I think, unquestionably be subject to the same requirement as other employees or students who are accessing the campus on a regular basis. If we have somebody who's coming by for 15 minutes to drop off a package, will they be required to show evidence of vaccination? Perhaps not, but I think that's a detail that we've got to figure out. How do we have appropriate rules to allow the normal interaction between ourselves and the rest of the community without creating a huge bottleneck, but also without leaving a big loophole in our rules?
Great, thanks, Jerry. I'm going to leave you alone for a few minutes and turn to Wafa because we do have some questions about variants and the effectiveness of the vaccine on the variants.
Sure. Thank you very much. And this is also another area where we have accumulating evidence that is actually reassuring in terms of the antibody response and the protection from several of the variants that have been circulating, including the ones that are circulating now widely in the United States. So currently, the vaccines we have available in this country appear to be quite effective and with a good antibody response that's not substantially diminished at all against the various variants. Of course, variants evolve all the time, and this is an evolving area. So as variants are introduced in a population, and particularly as they predominate, then the research is done to determine what the impact is in the context of the vaccine. But for now, the data are reassuring in terms of the vaccines available to us to now against the currently circulating variants.
Great. Wafa, a second question for you on vaccinated people and transmission of COVID. Is there a consensus on whether or not vaccinated people can transmit COVID to those who are unvaccinated?
The data now are also reassuring. Remember, we've had kind of actually good news after good news after good news. First, we knew that the vaccines were good in preventing moderate to severe illness. Then we learned that they were actually really good at also preventing asymptomatic COVID-19. And then we have also now population level data that the vaccines also decrease transmission to others who are not vaccinated, so decrease the risk of COVID-19 in the population overall. And this is likely because the vaccines, even if you have a very mild case of infection with COVID-19, the likelihood is that the amount of shedding of the virus is so diminished, so minimal, that the risk of transmission is very much abrogated post-vaccination.
Great, thank you. There's a question I'll answer and give our other panelists a moment to breathe. It is, how will an employee receive confirmation that their submission of their card has been accepted? And you absolutely will. If you look at your Reopen CU app, there is a section on it called My Checklist. And there are already pre-checked items, because in my case, for example, I have signed something called the Columbia Compact, which we'll be revising to update these mask guidelines, distancing guidelines, vaccination guidelines, and the like. There's a training element where we had to take training as we came back to campus. And then there's the testing requirement. So what will happen is there will be a fourth box that will say, I have met the university's vaccination requirements. Again, that'll give you two options: one, to submit your information; the other, to apply for an exemption. And then that will be pre-checked. So you'll never have to worry about that once we've accepted your documentation. Okay, so Melanie, there are still a lot of questions about gateway testing in the fall, both whether or not it's going to be required, and what's our thinking about why we are going to continue to do COVID testing in the midst of having a vaccine mandate for everyone.
Thanks, Donna. I think that's why we haven't said exactly what the testing program will be for the fall, because we really need to reevaluate it based on the vaccine mandate to make a determination on whether or not gateway testing is required for all those vaccinated, and what kind of surveillance testing makes sense when we have our largely vaccinated population. So we do not yet have the testing guidance for fall return. All I'm able to share right now is if you are coming back in the coming weeks, you are still required to receive the gateway test. That's because we don't have vaccination information on anybody. And that is why we're continuing to require participation in our random surveillance testing program at this time. So we anticipate by June, so in the next couple of weeks, we'll be able to share more information in terms of what fall testing will look like, and if there are differences between various groups, so those vaccinated, those not vaccinated, those partially vaccinated. I know it's confusing, and I would just say at this time the focus is on our current access to campus and our current testing, which is still required.
Great. One of the important points about the vaccine information that is going to be submitted to us is it will not be provided to anyone. It's not your supervisor, not your colleagues. It will go to HR, and it will be in a secure system at CUIT, but we are not releasing any of that information to your supervisor. Melanie, can you also, another question about the fall is around masking, and what will our policy be around masking if you assume everyone is vaccinated, but there still obviously are people with some exemptions. Who's going to be required to be a mask? Excuse me.
Again, another one where I'm very comfortable sharing where we are today, because I think a lot of us feel like we're getting whiplash from hearing where these recommendations are going, where the changes are happening. So there was a lot of information coming out from the CDC, and now just in the most recent days from New York State, in terms of what fully vaccinated people can do, and a lot of that pertains to masking. So there is guidance around what you can do in your personal life around taking off your mask when you're around other people who are vaccinated. What does this mean on campus right now? So there's I think two important distinctions, and the distinction is indoor versus outdoor. So today, outdoor on campus, if you are fully vaccinated, you are not required to mask any longer. However, we are continuing to require right now masking indoors at any of our campus facilities, and that is because we don't know who is vaccinated at this time. Again, we're going to reevaluate that based on the evolution of the vaccination status of our community. So for now, outdoors on campus, we are no longer requiring masking for vaccinated individuals, but we are still requiring it indoors. The one important caveat to that, and Donna, I'm sure you'll mention it if I don't, is healthcare facilities. So for CUIMC, masking is still required at all times. Healthcare facilities, we have many immunocompromised patients. So that is a slightly different one. So the difference right now is just for the outdoors, but indoors, unless we're in our private offices like we are now, we put our masks on as we leave our offices and navigating other indoor campus spaces.
Great, thanks, Melanie. And you're right. At CUIMC, most of our buildings are connecting. They connect with NYP. There have been a number of questions in the chats, in the Q&A about is NYP going to mandate this? I know they are considering it. They've not made a decision yet. But even in some of the administrative buildings, we are connected. We see physicians. We sometimes we see patients every day. I walk through an area where I see patients, and so we will take a broad definition of healthcare facility here, so that where there are clinicians who are treating patients and/or patients, we will continue to mask, even if you feel like within your unit you are purely in an administrative area.
And then can I just add one more thing, Donna? When we think about the fall, and I know there's a lot of questions, well, will we be required to test in the fall? Will we be required to mask? Will we be required to distance? We are still awaiting the CDC's guidance for higher education around this, and then New York State guidance around this. We're hopeful that it's going to be coming soon, but a lot of what we're required to do in our workspaces is guided by the state requirements. So there's a lot that we have to wait for that guidance before we can determine what Columbia's approach will be.
Great. Thank you, Melanie. I'm going to turn back to Jerry and a non-vaccine related question, but a lot of the work that Jerry's been leading across all of the campuses is about return to work. And Jerry, the question is there a time frame whereby in this particular case, this employee needs some notice to return to New York City, hasn't heard from their department, and could you share with the group what our return to campus policies are?
Yeah. So I'm sorry that this person hasn't already heard, and I think if you're still on and hearing this answer, I think you should reach out to your supervisor and ask for some guidance and make clear that you have a special case where 21 days may not be enough for you in terms of notice, and that you want as much early warning as you can get. It doesn't guarantee that they'll be able to provide it, but it's certainly worth asking. What we're asking each school and department to do is to come up with its own plan based on its assessment of its needs, what people the department needs where to meet their responsibilities. So as I say, there is no fixed timeline, but many schools and departments are already well underway in bringing people back. Some of them have even experimented by asking people to come back for a week or two just to get used to the idea and to see that it's manageable, that it's safe here. And then to continue working remotely with the expectation that they would return on a more permanent basis, perhaps later in the summer. I don't really know how to give any definitive answer on when you can expect to be back, but I would say by September, the great majority, as I started with that quote from Donna and from Ira, by September, we expect the great majority of our people will be back on campus working here, and many of those people will be back before then as part of the lead into that.
Great. We have a question that I think we'll all chime in on. This is somebody who got a notice from their gym that masks and reduced capacity were no longer required, and the question is, how can that possibly be safe? The governor, and I think one important thing for us to frame is what the CDC and the state have said is also goes through a lens here at Columbia, because we do think we have a superior track record to keeping people safe and keeping our COVID numbers down. The governor did allow that occupancy limits were going to be reduced. But the only time that physical distancing indoors should be eliminated is when people are vaccinated. So your gym, I think, is a little off. Melanie can add, but unless they're collecting vaccine information and validating it, they should be having masks and should be having, they could have reduced capacity, but they can't have physical distancing eliminated.
And I think this is where it's really interesting to make individual choices based on a couple of things, based on your own knowledge of your own vaccination status, so what you can do safely, and then your own comfort level. So seeing how your gym is set up, if the machines are more than 6 feet apart, and even if others aren't wearing masks, you always have the choice to wear a mask if you choose in those settings.
Great. Jerry, a question which is a little bit of an HR question for you, deals with part-time faculty who actually aren't active in our systems until after September 1st. We're asking them to comply in August. You may not have an answer right now, but I do think it's a problem for us to take back and try to solve, unless you already have an answer.
No, I don't. I think I've tried to be careful to talk about current employees, because someone who doesn't even work for us yet is going to have a different timetable for compliance. What I think you're talking about, Donna, is someone who does work for us, but who has a schedule that means there's no reason to be here for some significant period of time. And I think we need to figure out how to adapt to that. But my advice to that person would be, get vaccinated right away and do the attestation and just be done with it. And then you don't have to worry that you're not just doing us a favor, you're doing yourself a favor by doing that. But I think we need to figure out how to work out some timeline for those who are gradually coming back.
I thank you. And I think we can never say too many times, Columbia is providing vaccinations to all its affiliates at no cost to them. And we're doing it in 6 locations right now. Appointments are really easy to get, and in some cases we are even taking walk-ins. So please go to the COVID-19 website and you'll be able to get those appointments.
And I could just add, Donna, for the remainder of this week at the Lerner Hall site from 9 a.m. to 4 p.m., we are accepting walk-ins, and we have the Johnson & Johnson vaccine available. So if you're looking for the one-shot vaccine, you don't even need an appointment this week, 9 a.m. to 4 p.m. at Lerner.
Great, and that's another question that we've gotten. Can you pick what vaccine brand you're getting?
So not really. It depends where you're going. Most sites will let you know what you're getting. And certainly at Lerner, if we have 2 different available on a given day, we'll let you know. So just check with the vaccine site that you're going to. But really, it depends. We never know what supply we're going to get, and that's what we give out.
Great, thank you. But we have gotten all 3. I will say that the majority of the vaccines that we have administered have been Pfizer. Wafa, I'm going to turn to you for a question about antibodies. And the question is, what about the announcement that those with COVID-19 antibodies are not being required to take the vaccine?
I'm not aware of this announcement. The recommendation is that for people who've had COVID-19, after, of course, they recover from the acute illness, that they should be vaccinated. And the reason for this is that we do have pretty compelling data that the antibody response, the magnitude, the height of the antibody response is much better after vaccination than after a natural infection. So that's the reason why it's recommended, even for people who've had COVID-19 in the past, that they should get vaccinated.
Thank you, Wafa. There are also a few questions about pregnancy, nursing, fertility. Could you tackle that general area?
Yes, and that's been an area of enormous interest over many of our webinars. And just recently, there have been, again, reassuring data with regards to 2 things for pregnant persons. One is that the data are show that pregnant persons had a very robust response to the vaccines, which is really good. because there was concern that the response may be decreased in pregnant women. That was not seen. So there's an excellent antibody response, which of course bodes well for a protective effect of these vaccines. And also, again, based on the available data on vaccinated women, there does not appear to be any side effects that are of major concern at this point in time. There is no reason to suspect that these vaccines would have an effect on fertility, and that's based on just what these vaccines are made of and how they act. There should not be concern that they may affect fertility. So we have accumulating data with regard to particularly to pregnant women. As always say that for pregnant persons, please consult with your clinician. But the CDC and the WHO both indicate that the vaccine benefits, again, are really important, particularly because we have data that show that pregnant women are at higher risk for getting more severe COVID-19.
Great, thank you. I'm going to ask Melanie to do a little work. We have a request to put the link for where to get gateway tested or to make your appointments for gateway testing. Could you put that into the Q&A box? And the other part of the question was, how do you upload the COVID-19 card? Again, go to the App Store, get your Reopen CU app, and by the 28th of May, you'll have that information. Okay. We forgot a lot of density questions. And so the density questions, we have made a decision that with a fully vaccinated student population and workforce, and we've made this decision based on the guidelines that we've seen from the governor, that we will not need to do physical distancing. Masking will still be a part of our lives going forward indoors. And one thing that I know we want to urge you not to do is to stigmatize anybody who chooses to wear a mask. They may just decide to do it even though they're fully vaccinated because they want to be protected. And so mask wearing means nothing other than you've made a personal choice. Okay, so we are almost at time, and I'm going to turn to Jerry to see if he would like to wrap up. I want to remind you of a couple things. First of all, we got 388 questions during this forum. I think we answered literally on the screen 108 of them, but I know many of them are clustered together, so I think the number is greater. And the second thing to remind you of is the fact that we have recorded this session. It will be posted on the COVID-19 website. And then the third is we'll be back in 2 weeks. Things have been so fluid and changing so rapidly that 2 weeks ago we had a very different forum, and 2 weeks before that, and so on. So we suspect many of you will want to tune in. We'll get to questions that we haven't been able to get to, and as I said, it's an evolving situation. But let me turn back to Jerry Rosberg for some concluding remarks.
Well, not much wrap up left, Donna. I was going to say the same point you made about 2 weeks from today, same time, same station. We hope it will be another interesting session. There were, according to my screen, something like 2,200 people on this webinar today. So I thank all of you for your interest in this, for your concern about Columbia and wanting to understand what's going on. We know that this is difficult and that it is a source of stress for many people, and we regret that, but we're trying to do the right thing. And you should also know that everything we've done throughout this has been guided first and foremost by science and trying to understand the data and the scientific analysis. And that's why this is the Donna, Wafa, Melanie show, because they are just part, not all, but a significant part of the really incredible scientific brain power and experience that's been brought to bear on this. So thank the three of you from all of us non-scientists. Thank you.
Thank you. Thank you all. Have a good day.